All right, I'm here this morning with Dr. Brandon Brunner of Elmbrook Family Dental. We first met Dr. Brunner at Clinical Mastery Series, wasn't that right?
Yes, sir.
Where we first got together with
Yep.
Mike Smith and John Nosty and Eric Farmer, and started to develop a relationship with Dr. Brunner. I believe you added the joint vibration analysis first. And
yes, that's right.
And then
Yeah.
you went into Dr. Almos's TMJ Therapy Center program, getting more interested in TMD, craniofacial pain, and developed into there, and then added the laser to your office.
Yes.
Right.
Yeah.
Brandon, Dr. Brunner is on vacation in Florida this morning. I apologize, I'm unshaven. I did a 2-hour training in Vietnam from 5:30 this morning until 7:30 this morning. So
That sounds fantastic.
It was really neat. It was six doctors researching at Ho Chi Minh Dental University. So that was kind of fun.
We should go there.
Yeah, we should. Well, let's make a plan.
Let's do it.
What I wanted to talk to you about, Dr. Brunner, is in Dr. Almos's system and his protocols for diagnosing and treating. That's something that you've really incorporated into your practice, and just wanted to ask you to talk a little bit about how JVA and the laser has impacted your practice in the area of TMD and craniofacial pain.
Yeah, it's been a good journey. So I think the JVA has been great for patients where, let's say, they maybe have some really mild symptoms. You can measure it. So sometimes those mild symptoms are actually, there's more going on there, where then you can say, well, look, these sensors can measure the dysfunction that you hear, and it'll quantify it. So now we have a baseline of where you're at. And then what we do is, as we progress through treatment, we remeasure them about 3 months later, and to say, typically, oh, look at your dysfunction is better. Mm-hmm. And not look how it's measured versus any other way, where it never made sense to me. If all you had was Doppler or your fingers or a stethoscope, I'm not really sure how that gives you quantification. So to me, it was a no-brainer right off the bat that you could actually measure something that was, I guess, prior to learning about it, immeasurable. Right.
Well, and also, I think what a lot of clinicians go by is patient self-report of pain or dysfunction. And, sometimes, I don't want to make the statement not being a doctor, but do you see sometimes in that therapeutic process, they don't necessarily either feel better right away, oh my gosh, you gave me the silver bullet, or sometimes in the process of therapy, things seem to be getting worse when they're actually getting better?
Yeah, I would say that happens. Mm-hmm. I'd say generally learning through Dr. Almos, through his system, that we generally will find patients that'll ebb and flow a little bit, get better, get a little worse, get better, a little worse, but then overall as a trajectory on a graph, because we graph their visits in terms of symptoms, the graph is definitely increasing in terms of symptom reduction. So
Sure.
It's pretty cool.
Well, we were talking earlier, and you had mentioned that sometimes you'll have patients who, on joint vibration analysis, the amplitude actually goes up as they get a better range of motion, or they start moving more clearly, where they're improving, but the vibration might get louder, but it's in an earlier state.
Yeah, absolutely. I think from the beginning, if I didn't know as much as I learned now, is that just because the noise increases doesn't necessarily mean it's actually a bad thing. It just depends on the circumstance.
Right.
So, but be able to tell patients before it happens, like, if this happens and you actually get more noise, for you, that's a great thing. Right. Then, and when it happens, they're like more calm about it.
Right. It's an expected outcome as opposed to something you're trying to explain after the fact.
Correct. Yeah.
So
yeah, it's been great. It helps to show patients, like, if you say, well, you're supposed to be under 20 integrals, and they're at 500, or sometimes when they're at 80, they have no reference. They're like, oh my gosh, 80 or 60 or 50 compared to 500. It gives them an idea of where they're supposed to be and then where they're not.
Well, and what we hope is that it gives you objective measurement as far as what impact your treatments, regardless of what those are actually having on the function of the temporomandibular joint, just to give you one piece. you
Oh,
know,
absolutely.
that
Yeah,
puzzle.
it definitely, like I said, anything that has to do with numbers makes more sense to me than sound.
Right.
So, I don't know. What I like about BioResearch equipment is that you guys are in the measuring business. So,
Hmm.
yeah, I
Right.
like that a lot.
And that's where we try to stay. There's a lot of different treatment philosophies out there,
Yeah.
but you find what makes sense to you, and if you can measure your way through, all the better.